Ma'am, next page. Yes, ma'am, next page. Mm. Next page, ma'am. Next one. Next one, ma'am. Next page, ma'am. Okay. Next one. Next page.
Last one.
Okay.
Done, okay?
Okay,
Starting
ma'am.
minutes.
Okay.
Starting.
Hi, this is Hanu Lakshmi, and I'm a candidate for MSCOG Part 3 exam, and I've gone through the scenarios, and I'm ready for the structured discussion.
Okay. So you're having this waiting list for Gynae OT.
Mm.
Prioritize
Mm.
under this heading.
Okay. So regarding the first case, it's a case of a 29-year-old lady who has presented with vulval itching and a whitish vaginal discharge, and she has undergone this examination under anesthesia and biopsy of the vulva as well. So nothing more needs to be done in her case. And further information, we can ask whether there is any associated skin conditions, and dermatology referral can be considered. And we should ask for specific history of any sexually transmitted infections, and any systemic disease like diabetes should be asked. And how is her smear status, whether she is up to date and all the smears are normal or not. And also ask for any history of using any soaps, bubble bath, perfumes, panty liners, or tampons. And then we can consider taking a high vaginal swab for her for culture, and as well as pH testing of the swab to differentiate between the species. And she can be referred to a gum clinic where she can go on with the follow-up as well as the treatment. And second case is of a 79-year-old lady, and her biopsy of vulva has been planned for her, and there is occasional bleeding as well. So considering her age and the history, it can be categorized into an urgent basis, that is, it needs to be done within 2 weeks, and it can be done as a daycare procedure. So here, about the further information, we should ask for any history of any systemic disease, especially diabetes, then whether there is any history of any cuts or any trauma, any soreness down below, and considering her age, whether she is taking any hormone replacement therapy, any anticoagulants as well, and also the age at which she attained menopause. Then about the investigation, we can do a detailed pre-anesthetic checkup for her, and a full blood count, renal function test, liver function test can also be considered. And depending on her biopsy report, whether if it is a cancerous condition, then we can decide on the MRI as well to stage the disease. And then the third case is a 45-year-old lady who is a diabetic, and she's having heavy and irregular periods, and an endometrial biopsy, which was planned, couldn't be done. So this also need to be treated on an urgent basis, and it can be done as a daycare procedure. So since we are suspecting an endometrial pathology in this, we can consider doing it under general anesthesia. And since she is diabetic, we have to ask whether her sugars are controlled or not, and whether she's going to the specialist regularly. And her parity should be asked, whether it was a normal delivery or cesarean delivery, and that is to rule out any risk of any additions, or whether there was any history of infections, uh, to rule out why previously the biopsy couldn't be performed for her, and also ask for any history of any PCOS like acne, hirsutism, recent weight gain. Her body mass index should be asked for specifically, and this case can be considered as the first case on the list, and further investigations I would like to do the full blood count, the kidney function test, serum thyroid stimulating hormone, and also her blood sugars as well. And yeah, the fourth case is the case of a 56-year-old lady, and she has been planned for diagnostic laparoscopy for an adnexal mass. And uh, in the ultrasound, we can see there are more than two malignant features as well, and her CA-125 is high. And we have to ask about her menopausal status to calculate the risk of malignancy index, but definitely it is going to be high in this case. And what they have planned for her is a diagnostic laparoscopy, which would not be appropriate because the procedure suggested for her would be a staging laparotomy, and she needs to be admitted as well. And her management would involve a multidisciplinary team of doctors, including the gynae oncologist, the oncosurgeons, radiologist, Macmillan nurse, as well as counselors. And her treatment, and she can be referred to a cancer center as well. And her menopausal status should also be inquired to calculate the RMI. And and also regarding her investigations, a pre-anesthetic checkup should be done. Then a detailed full blood count, renal function test, liver function test, a chest X-ray, and also CT or an MRI can be considered. Then the next case is a 36-year-old mother. She's asking for laparoscopic sterilization as she's not able to tolerate any other form of contraception. So this can be done on a routine basis, and it can be done as a daycare procedure. So since this laparoscopic sterilization carries many cases of regrets have been reported, we need to counsel her properly. We need to take a detailed history, that is her obstetric history, whether it was normal or cesarean. Her menstrual history should be taken in detail, and what kind of contraception she is currently following. And then she should be advised about the pros and cons of this procedure as well. And all the alternative forms of contraception should also be made clear to her. And like long acting reversible contraceptions like a Mirena or copper coil can be advised, and always her wishes should be respected. And regarding the sterilization, we can tell her that there is a tubectomy or clips, and after that, if she's going happy to go with the procedure, then the consent can be signed. And also if she's having any excessive additional comorbidities or any risk factors, then the option of vasectomy can also be discussed with her. Then also we have to confirm that she's not taking this decision under any kind of stress or duress. Then the precaution we should advise her, she need to use condoms on top of this procedure, since condoms can only protect her against the sexually transmitted infections. And the investigations I would like to do, all the investigations, pre-anesthetic checkup, and all the investigations for the surgery, as well as an urine pregnancy test. Then the last case is a 60-year-old lady with a uterovaginal prolapse, and she is planned for vaginal hysterectomy and a pelvic floor repair. She is having a mild cystocele, and also there is urinary incontinence. So this can be either done as a soon-to-be procedure or a routine procedure, and she should be admitted. And here also a detailed history should be taken. We should ask about her sexual history to decide on the procedure to be performed, whether abdominal sacrocolpopexy or sacrospinous fixation. Then any problem with her bowel work should be inquired. Her profession should be inquired, whether it involves any weightlifting. Then her body mass index should be inquired, and also a referral to a urogynecologist can be considered, since she's having this urinary symptoms as well. And investigations, since she's planned for a surgery, we can consider doing a full blood count, urine routine, and a urodynamic test as well, because it can aid us in the surgery. And in all the cases, I would like to ask for any allergies, their blood group, and any reservations for blood transfusion if required. Yeah, that's
Last 2 minutes. Would you like to
that's
say something?
no, ma'am. Nothing more.
Last 1 minute 40 seconds. Okay. So shall I end it?
Yes, ma'am.
Okay. Anybody can point it out what she has done positively and what she has missed out? Very well done, huh? Very well done.
Oh, thank you so much, ma'am. Thank you.
Anybody? Please come up. Be a very strong feedback giver.
Ma'am,
Hmm.
ma'am, she has mentioned the categories inpatient and categories. Okay, ma'am.
Hmm.
But some extra like unnecessary histories.
Still, I'm okay. I'm giving
So
okay.
yeah, ma'am. Yes,
What
ma'am.
about appropriateness of the procedure?
Yeah, that appropriateness of the procedure for the first one.
Every case, she has
Yeah,
not
she didn't.
mentioned.
Yeah, yes, ma'am. She has not
She has
mentioned the
assumed,
appropriate.
yeah, she
Hmm.
has not mentioned in each case. So here
Hmm.
they had asked you to do four things only. Whether the procedure what they are planning is appropriate, categorize. She has done categorization in maximum one or two she has
Yes,
missed
ma'am.
out. Okay.
Missed and venue she told.
Venue she
IPR.
told. Okay. Additional things she has mentioned in detail.
Hmm.
The
Yes,
first
ma'am.
point she has missed out. So unless and until that point will not be ticked off, you have lost your 25% of the mark, even though you have done good job.
Okay.
Okay.
Hmm. Okay.
Okay, so that's the reason you have done a wonderful job. The only thing what they had asked you, you have missed out on that thing. So now
Hmm.
your time is completed. So the answer is very nicely you have started on this S bar tool. Okay, but you were reading maximum information rather than reading. You just point it out. Okay, so that is the point. Additional point also you had suggested, which I will include in my answer key also. Okay,
Hmm.
so the first case is she is case of vulval itching and vulval vaginal discharge. Okay, with unremarkable examination finding, she is posted for examination under anesthesia and biopsy. You assume that it has been done. Okay, don't assume. Assumption kills. That is my means
Hmm.
wordings. So examination
And
under anesthesia
slideshow,
and
ma'am.
biopsy.
Slideshow.
Okay, slideshow. Shall I go for slideshow? Okay. So SBAR, so she is a case of vulval itching and vaginal discharge with unremarkable examination for examination under anesthesia and biopsy. The appropriate of the procedure here, since the examination is unremarkable, examination of under anesthesia and biopsy is not an appropriate procedure. She is a young woman, so she is
Hmm.
more prone for STI, BV, TB, and candidiasis. Huh? So the procedure is don't go for invasive procedure first. So the first will be non-invasive. Treat that non-invasive cases and then even after that, if there is any abnormal lesion, then only examination under anesthesia and biopsy. So that is not an appropriate procedure here. What is so categorization and venue is not applicable in this case. What are the additional precautions? So you very nicely mentioned so many points about the history, details about any skin or dermat reference. See, she's not having any skin lesion as of now. So most common cause for this itching and vaginal discharge is either sexually transmitted infection or any bacterial or vaginal infection or contact dermatitis. So that very nicely you had mentioned that hygiene, perineal hygiene and all those points very nicely you had mentioned. Whether the patient is on uni contraception, smear history you wanted to know, so that I will be adding that history also. Smear history. Partner's details can also be asked, whether the partner is also having the similar complaints, and then what are the investigations you are going to offer her here will be STI screen, high vaginal swab, candidiasis screen by pivot preparation. There are multiple ways where by which you can rule out the candidiasis, and treatment accordingly, either tablet doxymetro plus minus fluconazole or cotrimoxazole paste series, gum referral, partner notification, and safe sex. Those are my points. Apart from that, you had mentioned regarding the hygiene. Okay, so I will add hygiene, smear, because smear history will also give us an idea about some points and additional things you had mentioned. Hygiene, soap, avoid irritants. Okay, so it might be contact dermatitis also, avoid irritants. Okay, so it might be contact dermatitis, but the most common reason for this in this itching can be any STI, BV, TB, or candidiasis. Done. You have mentioned most of the points. The appropriateness of the the procedure you have not mentioned. So because of that, you had just gained 25% of the mark. Okay, in spite of doing good. Now the next case is case of vulvar ulcer for biopsy. Do not read it out, just mention what for the patient, what is of the diagnosis and for what the patient is. So case of vulvar ulcer for biopsy, yes, appropriate procedure, because this can be a malignant lesion and we need to rule out the malignancy in this case. So it will be a urgent or 2 week targeted pathway. Daycare, this can be daycare procedure. Any additional precautions necessarily, check patient's condition including medical surgical comorbidity, especially diabetic patients are prone for this ls, and ls is more prone for vulval or vaginal carcinoma, vulval carcinoma. Okay, BMI, risk of smoking, previous smear, offer per abdominal speculum vagina per vaginal and local examination accordingly. Okay, now accordingly we will be posting this patient. The treatment will be further depending upon the biopsy. So MDT is very important. For biopsy, they will not go for PAC, or they will not go for this. Biopsy is a OPD based procedure, so she will not be requiring any concern here. But once the biopsy will be available, MDT, baseline blood investigation, CBC, LFT, RFT, and if biopsy is suggestive of malignancy, then only MRI. And management of the malignancy according to the MDT. For that, PAC and anesthesia review will be requiring for, but per se biopsy, she will not require anything. It's an OPD based procedure. It's an OPD based procedure. Now, the third case is case of HMB, IMB for hysteroscopy guided endometrial uh, biopsy. Okay, for hysteroscope guided endometrial biopsy in case of diabetes. Okay, appropriate, yes, because the patient is at risk of endometrial hyperplasia or malignancy. So this is an urgent case, that is 2 week or targeted pathway. Suitable venue, it can be daycare or inpatient. Why I am saying here inpatient? Because there was failed endometrial tissue sampling. Okay, endometrial tissue sampling was failed. So why it has failed? Whether there was difficulty in negotiating the os, or the tissue samples were not sufficient enough to get. So access those case details, and depending upon that, if it is a difficult negotiation, then we might have to consider giving her proper anesthesia and do it as a daycare procedure, or IPD, not IPD, daycare procedure. Okay, that is very important here. Patient may require admission for that. And if it is a stenosed os, then patient require measures to for dilatation, serial dilatation, even including cervical priming. Okay, so that is my way of discussing why it has been missed out, why they were not able to get the sample. Then sugars is important because she is diabetic. Electrolytes is important, hemoglobin, and if it is inpatient under anesthesia, then PAC needs to be done. Anesthetist review. Okay, anesthetist review is important for PAC and to be taken as a first case. Okay, and you had also mentioned about TSH, which I really like the way. Okay, so there is no harm in suggesting additional info in investigation if you are thinking, okay, that might be the reason. Okay, TSH. Any other point? Anybody can comment on this? So you mentioned about anticoagulant, hypertension, HRT, and all those points also you mentioned. But yes, you can mention those points also. Okay. PSC, full blood count, liver function test, and RFT, you were saying not needed in all the cases, dear. They just do CBC, X-ray, urine, and depending upon the comorbidities, they go for the other investigations. The next case was actually you had, this is not an appropriate for surgery, because here a case is a suggestive of ovarian malignancy, as and posted for diagnostic lab in a 56-year case with RMI more than 200. That you had very easily calculated that 3 postmenopausal 3 and this 140. So the RMI is almost more than 200. If at all you don't want to go into the exact RMI, but by just seeing at the thing, at least you can safely say that it is more than 200. That much knowledge is also sufficient, even if you will not calculate the exact RMI. Okay. So appropriate, no, this is not an appropriate procedure, so not applicable. The appropriate procedure here will be staging laparotomy after MDT. So her review, she will be reviewed initially in MDT, and depending upon MDT, she will be going for a staging laparotomy either as at a cancer center or gynecological clinic where the expertise are available. Okay. So this will be decided by the cancer MDT. Cancer MDT will be deciding by staging laparotomy and inpatient. She will be inpatient IPD case, targeted or 2-week pathway. Additional investigations to confirm the so MDT CT scan she will be requiring for this RMI since it is more than 200. X-ray chest to rule out any secondaries. PAC hemoglobin sugar electrolyte. Anesthesia case, no, she is not a lab case, no, so she need not be taken first. Mm? So anesthesia review. So these are the points which are important here, and depending upon that, she will be going for staging laparotomy after the MDT along with CT scan. Okay. The next case was yes P3L3. Again, this is an appropriate procedure because she is more than 30 year having completed the follow family, and she is not comfortable with any of the contraception. But here, before the procedure, I would definitely like to offer a discussion about LARC. Okay, so would like to discuss about the LARC and whether she is keen to reconsider her option of sterilization. That I will be insisting here. I will be also discussing, as you mentioned, right, like the pros and cons of all the options, including the sterilization. And it is a permanent procedure where reversal is not available on NHS. And if she has to consider, she may have to go for self-funded IVF or reversal procedure at a private clinic. Okay. The category of the case, it will be a routine case. Suitable case, it will be a day case. Okay, so lab sterilization is a day case. So now here what I am very keen, one thing is pregnancy, another thing is hemoglobin and PAC and anesthesia review. But I wanted to know, because it's a surgical procedure, so I would like to know whether there is any risk of surgical procedure or anesthesia risk. So BMI, any surgery, any medical comorbidities, it is very important. If there are any surgery, difficult entry, not completion of procedure, injury to the bladder, bowel, or nearby structure, we have to explain. So that risk categorization is also very important. So that risk also I would like to assess. So those are my additional points here, which you had missed out. Last case is a case of vaginal prolapse for a site-specific repair and vaginal hysterectomy. Yes, the appropriate procedure. Patient needs to be seen in urogyne before going for the procedure because she is symptomatic. She is having symptomatic urinary problems along with anterior wall prolapse. Depending upon the appropriateness, the categorization, the case is routine case. She is not an urgent case. IPD. Any additional precautions here needed? PAC, hemoglobin, anesthesia review, urine routine microscopy, and UDS. Because the patient is symptomatic, patient is having anterior prolapse, so she needs to be reviewed in MDT for UDS, and depending upon that, the procedure may differ in her care. And we would also like to know, since we are going ahead with the hysterectomy smear, any hysterectomy procedure, we would like to know the smear, and any surgery, we also, urine pregnancy test is a safety point in the case number of lab sterilization. Similarly, in this case, it's a smear. So basically, if you will see domain scoring, it is very weird, very vast. So each case will needs to have that particular information for pertaining to that particular case. Whatever you are saying, justify your action, why you need that investigation, you have to justify. That is also information gathering. And ask specific investigation in each case, that is information gathering. Communication, able to communicate with each patient about each patient in a clear management pathway and rationalize it. what decision you are taking, including timing of the procedure, venue, and additional investigation. That is very important. Able to explain clearly rationale behind decision changing. If you are changing any decision, why you are changing the decision, you have to explain. Communication with colleague, appropriate prioritization. Okay, differential diagnosis so that you can manage the case in an appropriate way. Demonstrate ability to prioritize cases into routine, soon, and urgent based on NHS definition of cases and the rationale for such classification. Patient safety. Understand your limit when you want to involve your senior or refer to the other specialties, including urogyne, genitourinary, oncology. So that all will be patient safety points. Understanding safe prescription inapplicable in safe all circumstances. So smear in hysterectomy, urine pregnancy test in lab sterilization will be considered as patient safety point. Okay, right surgery, right safe surgery, right surgery at the right place at the right time. So that is patient safety. Applied clinical knowledge pertaining to this is a wide spectrum. Be well versed with your RCOG and NICE guideline, including NHS recommended timelines for the management. Okay, so this is all about this task. Easy tasks means this kind of tasks are very easy to manage. If you are having a basic knowledge, you have started and you have presented it very nicely, dear. At least I'm happy. Okay, but do
Okay.
not miss out on that appropriateness and all those points. It is very important.
Yes, ma'am.
Okay, thank you. Thank you all.